name is Sarah Yoakum. I'm a speech-language pathologist and on the board of directors and the secretary for the Storyteller in the World. Today I'm going to talk about language and feeding development in children. In most countries or cultures, that development could be a little bit different depending on how the child is raised or where they're raised. So from about birth to 8 months of age, a baby will not have words, but they do start to do something we call babbling. Babbling is when a baby makes a sound. It starts simple, so they might say something like ma, but then that progresses to something like mama. From about 8 to 12 months of age, babies understand about 3 to 50 words, like no, more, sit. Their babbling starts to progress from something like ba to ba-da. From about 1 year of age, typically that's when a baby starts to say their first word. From a year or 12 months to 18 months of age, babies start to understand simple one-step directions like give me the diaper. They will listen to short stories. Their vocabulary starts to increase. When they get closer to about 18 months of age, they will start saying about 50 to 100 words. From 18 months to 24 months of age, they will understand more complex one-step directions like kiss the baby, kiss the ball. They will start to understand two-step directions like get your shoes and put them on. They will start putting two words together, like more milk, all done, and they will be saying roughly 200 to 300 words. Children from about 2 to 3 years of age will understand harder two-step directions, like get the spoon and put it under the table. They will be saying roughly 450 words or more, and start using 2 to 3 word phrases or sentences, like more food, mommy, no more, please. From about 3 to 4 years of age, they will understand simple questions and be able to answer them. They will be saying roughly 1,000 words or more, talk about what happened during their day, say about 4 to 5 word sentences like it was so fun or I want a snack please. From about 4 to 5 years of age, they will understand longer directions like put your pajamas on, brush your teeth, then get in bed. They will say roughly 1,500 words or more and start telling stories and keep a conversation going. From about 5 to 6 years of age, they will say about 2,000 words or more, use 5 to 6 word sentences, tell longer and more in-depth stories, and ask questions so they can learn more about what they might encounter. From about 6 to 8 years of age, they have a good foundation of their language, and they start to speak in full sentences. From about 9 years of age and on, their language and vocabulary will continue to evolve and expand as they learn and experience new things. It's also good to know that if a child's learning more than one language, there can be a delay in their speaking. Sometimes they have periods where they don't speak or they mix up the languages, and they may seem to prefer or be stronger in one language versus another. Talking a little bit about some therapeutic interventions that you can implement if the child maybe isn't talking or understanding like they should at that age. Some things that you want to ask are, what are they understanding right now? What are they saying right now? You want to pick the thing that would be at that next level. Language doesn't develop overnight. So if they're saying maybe one word, then we might want to work on saying 2 words or a word and a gesture. But we wouldn't want to work on maybe saying full sentences. That would be just a little bit too hard for them. It's good to repeat yourself. The children learn language by exposure to language. So just talk to them. If they're not understanding something, maybe repeat your direction again. Emphasize the word that you really want them to understand, like put on your shoes. You can simplify your language. So reduce that language load. Instead of giving them a big, long, lengthy direction, like, I want you to go sit down and put your shoes on before we go. Reduce all of that to where you're still getting the message across, but it's less language, like, put on your shoes. You can do things like point, gesture, or use visuals to help them understand better. Talk about what's happening every day in your daily life, like, it's time to take a bath. Let's wash your hair first. Describe what they are doing, like, you put the baby to bed. The baby must be tired. Or talk about what they're doing while they play, like, I'm running really fast. I'm going to get there first. Things that also help with development of understanding are reading books or telling stories to the child. You can improve talking by increasing communication opportunities or just giving them more opportunities to talk or want to communicate. You can try to make mistakes on purpose. Like if you know that they always really like their blue cup, then maybe give them the red cup and see if they will say something or protest or vocalize to you in any way. You can withhold things from them. So maybe give them one piece of food or one bite of food and then wait for them to try to communicate to you that they want more, and then give them that next bite. You can put desired items out of their reach, but maybe within their view. So their favorite toy up on a shelf where they can't get to it. So then they want to communicate to you in some way to get that item. You can also give them choices like, do you want an apple or a banana? And see if they can choose. It's also good to understand that some children are not capable of verbally communicating. So there are other forms of communication, like a child pointing to things, using gestures, using pictures, or looking at what they want. It's also good to just wait. Some kids need a little bit more time. Their brain needs more time to process information. So wait, give them time to respond. That is something that sometimes children need. Even a full minute or more, they might need that extra little bit of time. So transitioning from language development to feeding development in children and infants. So babies that are born at 34 weeks or more gestation, that means from the time they're conceived to the time the baby is born, if they have, at that age, 34 weeks or greater, they should have good coordination of the suckling and swallowing pattern in order to breastfeed or bottle feed. When they're feeding, you want to look for a pattern in their feeding. So maybe they suck, they swallow, and they breathe. Or they suck, swallow, and breathe. You want to look to see if they have discoordination in that pattern. Like maybe they suck, swallow, then breathe. We want to have a good pattern and see that pattern. They should be able to consume a bottle or breastfeed in about 30 minutes or less. If it's taking more than 30 minutes, there's a good chance that they are burning more calories than they are able to consume. And then they're just doing a little bit too much effort to try to get that food. So talking about some progression in drinking, from about 6 to 9 months of age, the child will continue to breastfeed and bottle feed as their main source of hydration. But if it's available or you want to try, the child can start to drink from a straw, but they will likely lose some of that liquid from the front of their mouth. From about 9 to 12 months of age, they will continue breastfeeding and bottle feeding, continue that as their main source of hydration. But now you can also start introducing cup drinking. From about 12 to 18 months of age, they will start drinking more efficiently from cups and straws, but they may start weaning from a bottle or breastfeeding if you would like to or it's desired. They can at that age. From about 18 to 36 months of age, they are efficiently drinking from straws and cups without losing the liquid from their mouth, and they can also continue breastfeeding and bottle feeding as needed or desired. When you start food, that's the question a lot of people ask is, when do we start feeding them real food? We want to look for some things like them sitting upright, unassisted, that they're able to hold their head up by themselves. For most babies, that's at about 6 months of age. So about 5 to 8 months of age, we start doing what they call smooth purees or really well mashed foods, maybe baby cereals, and then they also continue breastfeeding and bottle feeding. You want to see at this age that they're sitting upright without assistance, that they're holding their head up on their own, they're closing their lips around a spoon, and they're moving their tongue up and down. From about 9 to 12 months of age, they start eating more mashed foods that have texture to them, very soft foods, thicker purees. You'll start to see that their tongue will move to the sides of their mouth, and they'll begin chewing softer foods with an up and down movement. From about 12 to 18 months of age, they will start eating soft table foods, be able to move the food from the center of their mouth to the side of their mouth for chewing. You'll still see that up and down movement with chewing, but you might start to see diagonal movement of the jaw. From about 18 to 24 months of age, they start eating more adult-like foods, but you still want to avoid harder foods, stringy foods, foods with large pieces, or tough meats. You'll start to see that they have diagonal movement of their jaw, and then start to see a little bit of a rotary movement with their jaw as well. They'll also start to use utensils at this age, but it's often a little bit clumsy. From about 2 to 4 years of age, they will start to use their utensils a little bit more skillfully, be able to move their tongue and lips in a more skilled way. You still want to avoid the stringy foods, the tough meats, and the large pieces of food. At about 5 years of age and on, the anatomy of a child swallowing is more similar to an adult's, and so at that age, they're able to eat most all the foods that adults can eat. Moving on to feeding therapeutic strategies that you can use if a child's having trouble eating or swallowing. For bottle feeding and breastfeeding, some things to look for is if a child might be getting that food or liquid down the wrong way, down the wrong pipe, down towards their lungs. So some signs that you want to look for are if they're coughing while they're drinking, if their voice sounds a little bit wet during or after feeding, if they have noisy breathing or sound congested while they're eating or right after eating, if they're falling asleep while they're eating. That could be that they're just working really hard and using a lot of effort to feed, and that might be a little bit too much for them at that time. If they're losing milk out of the front of their mouth, could be that their lips are a little bit weaker, or maybe that the flow of the milk is a little bit too fast. If they start pulling or pushing away from the nipple, the bottle, or the breast, if they have facial expressions that show that they're stressed, like their eyebrows are furrowed or their eyes get really wide, or if their face is turning red or blue while feeding. If the mother feels pain while breastfeeding, it could be that the baby doesn't have a good latch as well. So some things that you can do to help a baby get a better latch when breastfeeding. When you go to latch the baby to the breast, make sure that their mouth is as wide open as you can get it. You can help that by rubbing the nipple between the nose and the top lip of the baby's mouth. When you go to latch them, bring the baby closer to the breast. Don't bring the breast to the baby. Let their bottom jaw touch first, and then have their top lip close over the breast, getting as much of the breast tissue in their mouth as you can. If the child's still having trouble latching, you can try positioning the breast so the nipple is pointing up towards the roof of the baby's mouth when they go to latch. Some things that you can do to help the baby get some milk. So if you notice that the baby is demonstrating difficulty getting milk from the breast, appears to be getting tired, or is easily distracted, you can try hand expressing the milk by pushing down at the top of the breast and moving your hand down towards the areola and nipple. You can do this as needed and do not have to do it for the duration of the feeding. You can also try changes in positioning. This also helps best support the muscles while feeding, or can slow down how fast the baby's getting the milk. So you can try cradling the baby close to your body with their head elevated and their arms and legs supported. You can hold the baby on their side with their face at your breast. You can try holding the baby like an American football with their legs off to the side of your lap and the baby's head at the breast. You can lay down on your back and have the baby lay on top of your breast with their legs pointing towards your legs. Another position you can try while breastfeeding is, if the baby's old enough, have them sit unsupported in your lap with their legs wrapped around your waist, with them sitting up and their head at your breast with their stomach touching your stomach. So now transitioning to positioning for bottle feeding. You can hold the baby in a cradle position with their head elevated and their arms and legs supported. You can also position the baby with their head elevated and on their left side so that their abdomen is not compressed. and any extra liquid can be expelled from the side of the baby's mouth if they're getting too much liquid. You can try a bottle with a smaller hole or a slower flow rate. You can also try pacing the baby, so every 5 to 6 sucks you tilt the bottle down so the milk is not coming out of the nipple. That allows them to swallow and breathe, then tilt the bottle back up until the nipple fills with milk and the baby starts sucking again. You can also keep the bottle tilted down a little bit so the nipple is only half full of milk the whole time the baby is drinking. You can try using the hand you are holding the bottle with to gently support the baby's chin, cheek, or cheeks while feeding. You can add a little bit of rice or oatmeal cereal to the bottle to slightly thicken the milk. This works well with formula, but not as well with breast milk. For assessment of eating with solid foods in children, you want to look at how their tongue is moving while they're eating. Are they losing food from the front of their mouth? How is their jaw moving while they're chewing? Can they close their lips around a utensil and take a bite? Can they close their lips around a straw and suck the liquid out from the straw? You also want to look for those signs, like with the breastfeeding and bottle feeding, some signs that the child might be having trouble with eating or that the food might be trying to get down the wrong way or towards their lungs. You want to look for things like crying, turning away from the food, pushing the food away. If they're coughing, choking, spitting food out, gagging, or throwing up. Some positionings you can try when the child is eating is having the child sit upright. If they cannot sit upright on their own, you can try positioning them in a supportive high chair with straps. You can try rolling towels, clothes, blankets, or anything and placing it at their sides to give them some more support. Or you can try having a helper hold the child while you're feeding them. To help a child learn to drink from a cup, you can try demonstrating this. You can try supporting the child while they're drinking by placing the cup at the edge of their lip, lifting the cup up until the liquid touches their lips, and then wait for the child to close their lips by themselves or with some finger support underneath their lip. You can try filling the cup not too full and just doing one sip at a time. If you want to teach a child to drink from a straw, if that's desired or available, you can try stopping up a small amount of liquid in the straw and then wait for the child to close their lips around the straw and release the liquid. You can also try regulating the liquid so that they suck just a little bit, one small sip, and then pinch the straw. If you're trying to help a child learn to eat from a utensil, offer smaller bites. You can support the lower lip with your finger. You can try placing the food on the edge of the spoon. You want to encourage the child to pull the food off the spoon with their lips. You don't want to scrape the spoon up, raking the food off on their top lip. You really want them to pull the spoon straight out and let them pull it off with their lips. You can also try using a spoon with a shallower bowl. If you're trying to help a child learn to chew, you can practice with softer foods like soft fruits, steamed or cooked vegetables. You can place it at the back of their gums or teeth. Demonstrate the chewing while they're chewing. If you're trying to help the child to learn to move their tongue while they're chewing, you can place a piece of food on the side of the mouth and practice moving it from one side to the other. You can use a toothbrush to gently brush from the back of the tongue to the front of the tongue to increase awareness and feeling. You can demonstrate that movement. In some cases, some children may have those signs or symptoms that we showed earlier with breastfeeding, bottle feeding, eating, that they might be getting that food down the wrong way. In some cases, we have to modify foods for the child's safety because we don't want anything getting in their lungs. So some things that you could try if you feel like it's a safety risk are giving them foods that are one consistency, like mashed potatoes, something that's a puree. You can try adding moisture to the food, like sauces, gravies, condiments. You want to avoid crumbly foods or difficult foods, especially if it's before the age of 5, like chips, popcorns, fibrous meats, sticky foods, or stringy foods. I hope this helps understand some things that you can do to help with language and feeding development. Thank you so much for your time.